Hey everyone, I hope you're enjoying your week. So today we're going to be talking about symptoms of a pulled groin in females. So before we get started, you can go to modomamassage.com to sign up for an introductory massage package. Yes, we'll be able to help you with this particular issue, but we'll also be able to help you with a host of others. So we'll talk more about that at the end. We're just going to dive right in. I found a great article on what you can do about a groin strain. So pretty much just where the groin is, it's going to be in the area of the body where the stomach meets the legs. So it's way up in there. It can be a little bit hard to diagnose, but once you do, there's a variety of stretches and different things that you can do that are really going to help you out. Immediately treating the groin strain can actually prevent it worsening and help it to heal. So you're going to want to get that diagnosed either by self-diagnosis or by a doctor, depending on how severe it is. Recovery time is going to depend on the seriousness of the groin strain. And you're going to want to know, how is it diagnosed? So wait, first of all, before I go into how it's going to be diagnosed, we are going to talk about, forgive me, I'm referencing my notes. We're going to talk about how you might have gotten this particular pulled muscle. So a lot of times a groin strain will happen from jumping. It will happen from twisting the leg, sometimes twisting and jumping, forceful kicking, changing direction suddenly when you're running, or lifting something heavy. A lot of pregnant women actually deal with this particular condition because they are carrying so much weight in their bellies, and it puts that strain on their groins. And I just remember, pushing something to the side with my foot whenever I was pregnant and getting a strained muscle that way. Another friend pulled her groin pretty severely whenever she was dancing in high school. So it can happen a number of ways. But it's just important to go ahead and start treating it. Excuse me. Whenever it's being diagnosed, again, either by self-diagnosis or if it's severe enough, you can go to a health practitioner. They're going to ask you a few things. Is there bruising or swelling in the inner thigh? Is there pain whenever you're raising your leg or your knee? Is there pain when you open and close your legs? The groin and the inner thigh may actually feel warmer than normal from the swelling. So that's also a symptom. Do the muscles feel weak or tight? I know that whenever people pull this muscle, a lot of times their legs can be really shaky. And so that's a sign that they have a pulled groin muscle. Is there limping or difficulty moving the leg? There's different grades of pulling the groin muscle. Grade 1 causes some pain and tenderness, but the stretch or the muscle tear is actually minor. A grade 2 causes pain and tenderness and weakness, but also sometimes bruising. So if you have bruising on your inner thigh, that's a pretty good indication of a mid-grade tear in your groin. A level 3 grade is a severe tear of the muscle causing bruising and a lot of pain. Whenever it's diagnosed, also they might ask you, did you hear a popping sound when the injury happened? That can be bad. Did you notice swelling after the injury? Did you feel pain? Do you feel pain whenever you're moving your leg? Again, so treatment options. The groin strain should be treated pretty quickly, ideally within the first 24 to 48 hours. This is to reduce swelling and bleeding and ease pain in the area. A person will often be advised to rest. You're going to want to rest your leg or legs. Staying still and trying not to walk or exercise may help the injury not get worse. A person can raise your leg, for example, by resting it on a footstool. Gentle movement can be done after 48 hours. You're definitely going to want to apply ice to the area. You can do frozen vegetables. You can use ice packs. Don't do it directly on your skins because it might cause ice burns, but you can hold that ice pack on the area for 15 to 20 minutes every 2 hours. You can, of course, take over-the-counter ibuprofen or acetaminophen. And like I said, if it's severe enough, you're going to want to visit a health practitioner. Another wonderful recovery option is going to be massage. At Modoma Massage, we are well trained in the area of helping you find relief not only for a pulled groin muscle, but for different areas of your body that are experiencing pain. So you can visit modomamassage.com to get started with your introductory massage package. As I always say, this is a health process. It's a journey. It's not just a 60-minute massage. It is so much more than that. So you can go to modomamassage.com to get started. And thank you so much for tuning in. I hope you guys have a wonderful day.